watching NBC10 at Issue.
Men hitting women, stalking, or psychologically or emotionally abusing women. It is a quiet epidemic, and it's been spreading among the young. The new age of domestic violence, now on NBC10 at Issue. Good morning, I'm Steve Highsmith. A woman wakes up in the morning with a black eye caused by a violent strike from her husband. It is a story that is far from unique. And despite decades of focus, domestic violence or intimate partner violence still happens a lot. And in some communities and demographics seems to be increasing. The financial cost to society is in the billions, the emotional toll unmeasurable, the physical sometimes ends in death. And technology has become a part of this problem, especially among younger people. What can you do about it? We start with a story. With me now is Georgeann Newman, a survivor of violence. She is also a volunteer with Lutheran Settlement House and its outreach to victims of domestic abuse. Georgeann, thank you for being here.
You're welcome.
You were in a marriage. At what point in this marriage did the violence against you begin?
Near the end of the first year, it started. We were in a fight, and I wanted to leave to get away from it. He had keys to the car next to him, and I went to take the keys, and it resulted in a fight over the keys.
And this fight, was it shoving? What was it?
It was shoving and pushing and like grabbing my arm. Like I had bruises from it afterwards.
And did you have children at the time?
Yes, I had my son at the time. He was about 2.
And when it was over, what happened?
I kind of went away, got out of the house, and was hoping things would calm down. And then eventually I had to go back because the things for my child was there, and I didn't have any money to go anywhere else.
And when you went back, what was the atmosphere? Was he apologetic? Was he angry again?
No, very apologetic, saying he was sorry. It was just in the moment. You know, he was upset and he didn't mean to do it, and it wouldn't happen again.
And then did it happen again?
Yes, lots of times afterwards.
And how frequently did it happen?
There wasn't any real set pattern to it. Sometimes it could be 2 days, and another time it could be a couple months before it would happen again.
Did you notice any cause that you could see for it, or any time, or any way you knew, oh, I think this is about to happen again?
No, it could be simple things. The kids, if they wanted to play with a toy, could upset them, and anger would go from 0 to 100. Or even something as simple as me saying, I'm not really sure what to make for dinner. What are you in the mood for?
Do you think alcohol or drugs influence this in any way?
I didn't know at the time, but he was using stuff on the side.
But you don't know for certain in every one of those cases?
I don't know if every one of it was.
What were you thinking as you noticed that this wasn't a one-time occurrence, that this was something that you were now in the middle of? Were you thinking, I can leave, I have to leave? Or were you hoping it would get better? What was you?
I was thinking that I wanted to leave, but didn't know how. I didn't have any income, and when I would talk to my friends and stuff in the neighborhood, they didn't understand. I had a beautiful house. He worked. I was a stay-at-home mom. You know, what was there to complain about? So
even your friends gave you the impression that something was wrong with you?
Yeah, or why couldn't I just be happy with what I had and just kind of deal with it?
Deal with it. At some point, however, you did decide to leave, but I guess did police get involved at some point, or did you just leave?
We kind of separated, and during the separation was actually when the worst assault happened. So he was picking up the kids for custody, and they didn't want to go with him over something that happened last time they were with him. And he kind of freaked out, and the kids ran back in the house. And when I went to the door, he told me that, you know, he couldn't deal with it anymore. So when I turned, that's when he came and got on top of me. And the kids, my daughter ran in to get a knife from the kitchen. She was only 7 years old at the time. And I told him to run out the back door for help with the neighbors. And I ran up the stairs thinking that he would follow me and leave them alone. And
this must be a horrible feeling, not only what's happening to you, but to see how your kids are trying to stop this.
Yeah, it is a horrible feeling as a mom, and you know, it's even more horrible to know that if you're not there to kind of be in the middle to take it from him, that eventually it'll go to your kids.
Did you ever see the movie The Burning Bed?
Yes, I did.
It came out in the 1980s. It's a story of Francine Hughes. Farrah Fawcett was the star of that movie. And in a period when there was a lot more awareness about this issue of intimate partner violence, when you saw the movie, did you relate to it in any way, or did you think, oh, I could be that person or not that person? At least in terms, not of what she did, but in terms of what was happening to her?
I never thought that I would be in that position. Just never thought that anybody could hurt me like that or want to hurt me. And then when I found myself in that position, and I thought if I was ever in that position that I would be able to stand up and speak out. But it's really hard when you're in it. And there are other factors that are controlling you to stay there, like my kids.
Well, at Lutheran Settlement House, one of the things that you do is you work on the hotline.
Yes.
And let's give folks a hotline number, and this is for any woman that has any questions at all about domestic violence. It's 24 hours a day. It's toll-free, 1-866-723-3014. We'll give this number again later in the program. What do you say to a woman that says, I hear what you're saying, Georgeann, but I'm just as afraid as you were, and I'm afraid I can't leave, that I'll either have no money or that my kids will be harmed? What do you tell them?
I tell them that is the most dangerous time when they're leaving, and we safety plan around things to make it more safe and give resources to women that I didn't know about at the time. So there is a shelter available, or look into what other options they may have.
And how do you feel right now in your life? Do you feel that you are in a new era of your life, a better place?
Yes. About a year ago, they asked me to help volunteer, and I started the training, and I've been working there since February on the hotline. And I feel strong and empowered, and to be able to help someone and be that person that someone was for me on the other line to get me out of that situation is very empowering.
How do you think your kids are recovering from this?
Oh, they're doing excellent. So, they weren't ever able to speak up or say anything when they were with him. And my son was the president of his high school class. He's in college now for music therapy. My daughter is just now she got elected to the student government. My daughter lost 100 pounds because she used to, eat more to be able to soothe that. So they're doing wonderful too.
Well, that's good to hear. We'll stay with us. Coming up, 2 more women join us to talk about what many women are going through, and we talk about prevention steps and other ways to stop the violence as NBC10 at Issue continues. Stay tuned.
You're watching NBC10 at Issue. You're watching NBC10 at Issue.
The abuse of an intimate partner, it has been called the quiet epidemic. It affects 1 in 3 to 1 in 4 women, but is rarely mentioned. Some men, and though there is much more support for women than in the past, the number of women victims has been growing. Back on NBC10 at Issue, I'm Steve Highsmith. With me is Georgeann Newman, survivor of domestic violence, now an advocate on behalf of victims of abuse. Also here are Jeannine Lisitski, Executive Director of Philadelphia-based Women Against Abuse, and Brenda Shelton-Dunston, Executive Director of the Philadelphia Black Women's Health Alliance. Thank you for being here. Jeannine, so we've got 2 to 4 million women in America in any given year that are being affected by this. What about our region?
In Philadelphia, the police respond to over 108,000 calls of intimate partner violence per year. We actually saw a doubling of domestic violence homicides back in 2010. And so since the economic downturn, we've seen an exacerbation of abuse. And, that could be threefold. One is because the victim has less resources to leave, that the economic stress can exacerbate the level of abuse by the perpetrator. And third is that human service organizations have less of a safety net. One example is even at the state level with the cuts in general assistance, a single woman, that could be her only way out to get a room, and now she doesn't have that option.
So to say, Brenda, that this increase that we've been seeing in certain quarters has to be ascribed to simply better reporting, that would be false. You think you're actually seeing more incidents?
I'm not real sure. That's a difficult one, really. It is, because as far as more reporting, maybe that's it. But being out in the community and actually seeing what is occurring and the impact not only on the women but the other family members and especially the children.
We see different things over the years, different reports. For example, Jeannine, that there's an increase in violence by men against women after certain NFL team losses, after sporting events, after an unexpected loss by a team, whether it's because betting was involved or anything else. Are you seeing any new trends that are out there? Are we seeing technology affecting? Are we seeing middle and high school students?
We certainly, technology is another weapon of abuse because domestic violence is a pattern of coercive behavior in order to control someone. So, you know, with new technology, everything can be used as another way to control someone. So certainly with teens, we see a lot going on with texting and stalking through devices and
because we're not only talking about physical abuse and sexual abuse, but we're talking about, as was mentioned by Georgeann, financial abuse and psychological abuse and emotional abuse. And that financial abuse, I mean, was that part of the controlling of you?
Yes, because there was a threat that if I left to go on my own, that I wouldn't have the money and the kids would be taken away from me because I wouldn't be able to care for them.
What answer do you have, Brenda, for that, for a woman who says that I want to get out of this, I'm afraid?
She needs a friend. She needs a support system. She needs someone to talk with, to help her think through the reality of the situation, the direct impact on herself, but also on the children as well. And with the services that are provided by the agencies.
But that support is there.
That support is there. Sometimes, however, it takes encouragement for that person to take the step, to reach out.
Talking about steps, there's the annual walk coming up. I want to give people some statistics about that coming up. The Walk to End Domestic Violence, it's the 6th annual. It's on October 26th, coming up this Saturday, and it's along MLK Drive, and it starts at 9:30. Registration's as early as 8 o'clock, and you can go to womenagainst.abuse.org, for example, to get all the information about it, and we'll give that information again on that. And of course, there is the hotline also that's very important, and we'll give that again. But Jeannine, when you think about the walk and you've been involved with that, what's the value of that? What do you get out of that?
There's a lot. One is that it actually benefits the Philadelphia Domestic Violence Hotline so that we can be there 24/7 for whoever needs support to get out. And that's actually a great first step for anyone who wants to try to figure out how can I get safe. In addition to that, the walk gets the whole community out. We have people from city council, some state legislators, different city agencies, and the community at large, just to hear about domestic violence, to take the stigma away from it, because so many people don't talk about it. They think it's a family issue. And I think by being so visible and walking with thousands of people, you know, it's really a way to get community awareness that this is not okay, that this doesn't just impact the family, but it impacts the whole community.
I want to talk to you about shelters and also prevention steps when we continue. More on getting out of an abusive relationship and preventing violence when NBC10 Edition continues. Stay tuned.
You're watching NBC10 at Issue. You're watching NBC10 at Issue.
NBC10 at Issue continues. Each day in Philadelphia alone, there are more than 300 domestic abuse calls to police. With me are Georgeann Newman of Lutheran Settlement House, Jeannine Lisitski, Executive Director of Philadelphia-based Women Against Abuse, and Brenda Shelton-Dunston, Executive Director of the Philadelphia Black Women's Health Alliance. How many shelters do we have in the region, Jeannine?
We have, in Philadelphia, we have one 100-bed shelter for victims of domestic violence and their children. And that includes children. So at any time, we might have about 40 adults and the rest children. And in Philadelphia is the poorest major city in the nation, and we only had 100. Other cities our size had about 250. So through many years of advocacy and the trends that we were turning away exponentially more. 5 years ago, it was about less than 2,000. Last year, 9,000 requests for safe shelter turned away.
So you're turning away women. That's not a good message.
That's not, although the good message is that City Council really came out and advocated for funds for a second domestic violence shelter.
Will that be ready by the end of the year?
There'll be 100 more beds, and that should be ready in the spring. And in addition to that, we've created some other programs to deal with people when we can't shelter them.
Well, by my count, there is not a shelter in every of the 67 counties, for example, in the Commonwealth of Pennsylvania. So there is a shortage of shelters, there's no doubt about it. When you look at one of the first lines of observation, which could be a physician, a hospital nurse, how is that working today in terms of their awareness or willingness to get involved?
It is better. It has improved. There, in some of the hospitals and healthcare institutions, there are programs to increase their awareness and knowledge, as well as improving and developing policies and procedures. However, that is not across the board. In every healthcare institution, there are some that are more sensitive. There are gaps as well. And
I guess a lot of these hospitals don't necessarily have the in-hospital support services that would be the next step, too, for a lot of those folks.
A lot of them do not. Efforts are moving. There is some awareness, but it needs to be increased.
Georgeann, when you had physical injuries, or if your children were affected in any way, did you have any conversations with physicians or nurses?
Yes, the school nurse and also the pediatrician for the children.
How would you describe the reactions?
Not good at all. They didn't want to get involved, and they made it clear that they would not get involved.
Did they give you a reason? Were they afraid? Were there just too much paperwork? I mean, what are they?
I felt like they just didn't want to have to go down to the court and take the time out and things like that. So, and I was like, can you just treat them at least? You know, because they were more concerned with getting involved than even treating them.
But there is an answer to a lot of this. And again, let's give the hotline if we can again, please. It's 1-866-723-3014. That's 1-866-723-3014. It is confidential, and you can tell people your story, and they will give you good advice. In addition to that, there are some prevention steps that we should talk about if we can. Report the violence. It is violence. So you can call it domestic violence, intimate partner violence, man on man, woman on woman, man on woman. It doesn't matter. It is violence. There is support for you to get out of the abusive relationship. There are volunteers. You can volunteer, and you can teach children to respect others and also support services for women. Anything in there, Jeannine, that you'd like to highlight or add?
Just that Women Against Abuse Legal Center and the Philadelphia Domestic Violence Law Enforcement Committee has worked really hard together to change the police response to domestic violence. So I want to encourage people. It is a crime, and report it. And if you don't feel comfortable calling the police, call the Philadelphia Domestic Violence Hotline, and we can start working with you. There's also legal services available, legal representation in order to get a protection from abuse order. Legal representation in custody and support cases, and we often know that abusers will use the children as a weapon. So these are really important resources.
Georgeann, were you worried at all about your phone usage or computer usage, that your now ex-husband would have seen those things or be tracking you?
Oh yeah, like I don't know so much the tracking, but knowing if I called somebody and then having to pay for that when he found out.
Jeannine, is there an answer for that? I mean, how?
One thing I advise people to go to the National Network to End Domestic Violence website. There's a whole section on technology, and it will tell you every way that you can be tracked. And it's important to know because it's easy to stalk and track
Care does have
people.
to be taken.
Absolutely.
Where to start to begin ending the quiet epidemic next on NBC10 Edition. Stay tuned.
You're watching NBC10 at Issue. You're watching NBC10 at Issue.
And we're back on NBC10 at Issue with Georgeann Newman, Jeannine Lisitski, and Brenda Shelton-Dunston. Give me an action step. What would you like to see happen?
I am from the area of public health, and I focus on collaboration. Abuse, domestic violence, trauma, etc., is not just focused on one aspect of our lives. There is a continuum. The continuum impacts all levels of providers, be it the community-based organizations, federal, state, hospital healthcare providers, police, etc.
More collaboration.
Must come together and collaborate to identify and come up with a solution.
Jeannine?
I think kind of on the line, but I would talk about policy at the federal, at the state, and at the local level. Every policy and every stream of funding needs to analyze how does that intersect with family violence and what do we need to do.
Georgeann, what would you say to a woman who's in an abusive relationship right now?
To definitely call the hotline and reach out was the best thing I did. Once I walked through the doors of Lutheran Settlement House and got the support and non-judgmental help, I was able to be empowered to not be a victim anymore and become a survivor.
And Brenda, there are new challenges in this field all the time. There are immigrants, there are different subsets, communities, and cultures that may have more problems with this than others. We have to face that.
That is true. The fact of the matter is that African American women, there is a larger amount of domestic violence. As far as some other individuals from other disciplines or ethnic areas, they also may have challenges because of the ability or inability to communicate.
And that's why
they're
it's
addressing
important
that as well.
That folks get involved and engaged
Absolutely.
and collaborate. And let's remember the Walk to End Domestic Violence. It's the 6th annual. It's on October 26th coming up. 9:30 in the mornings when it starts. MLK Junior Drive at womenagainst.abuse.org is all the information you need. And also remember, folks, if you're in a relationship right now or you know someone who does, you want information, and it's very private, go to the Domestic Violence Hotline, toll-free 24 hours, 1-866-723-3014. That's 866-723-3014. That's it for this edition of NBC 10 Edition. I'm Steve Highsmith. Thanks for joining us. We'll see you next week on NBC 10 Edition.